process, okay? A scientist. PhD, cell biology. He's a court-qualified witness, editor and reviewer for United Nations preparatory document to reschedule medical cannabis. What that means is his document was at UNGAS. UNGAS is the United Nations when they got together for 419 to discuss cannabis, medical marijuana at the UN. He did the document, supported document. This is his background here. He attended Temple Medical School. He is, yes, that sounds bad, but BS in cell, sorry about that. BS in cell and molecular biology and chemistry from San Francisco State University. He's chief auditor, bless you, patient-focused certification. He is also the chief scientist, we said that, and co-founder and previous R&D director at Green Standard Diagnostics. He helped create product safety standards that have been adopted in 16 states. He's an expert on everything. That's all I can tell you. I had the good luck of sitting with him at a dinner table last night. Him and Dr. Berman and I just sit there and went, wow. So I am very honored to have him here today. This is Jahan Marcu.
All right. Thank you for that wonderful introduction. So I'm kind of proud to be the only person who's going to be talking about growing cannabis at this event. So this talk is entitled Responsible Cultivation Policy. And first, I'm going to tell you just a little bit about the lead researcher who conducted this research on regulating cannabis as a commercial crop, agricultural crop. Kristen Nevedal is the researcher who conducted and put together most of this presentation. She's a co-founder of the Herbal Growers Association, and I work with her at patient-focused certification. And I'm going to talk to you a little bit about that so you understand the context of this program. But this is Kristen. I'm happy to direct. If you have more detailed questions about cultivation standards, I'm happy to put you in touch with her. You know about me. So the objectives, I'm going to tell you about our certification program, which is active internationally, and the standards of which have been adopted by 16 states. We're going to go over cannabis as an agricultural crop, overview of national policy trends. We're going to compare the environmental costs of different regulatory models, indoor versus outdoor, square footage versus plant numbers. What are the environmental impacts and what are the resource uses on those different regulatory models? We're going to discuss environmental consideration, the effect cultivation bans have, and some responsible solutions for regulating a crop as an agricultural product. One of our allies in this battle to regulate cannabis like a plant is the American Herbal Products Association. Now they have a cannabis committee where anyone can join. They have 4 committees on different, manufacturing, cultivation, dispensing, and laboratory operations. Free to join. Their standards are publicly available. They have a history of fighting the FDA and winning. They led the most successful grassroots campaign in the United States by having in 1993 to 1994, more letters were sent to Congress about the right to choose herbal supplements and botanical medicines than any other letter or any other topic, more than war, peace, the deficit, the right to life, anything you can mention. And this was to stop the FDA Commissioner, Larry Kessler, from making all botanical medicines and dietary supplements illegal food additives in this country in 1993. And he surrendered to the Trade Association. They wrote a piece of legislation called the Dietary Health and Supplement Education Act, which allows you to make claims about products based on their content. So if a product has vitamin C, you can say that it's good for you like oranges, right? Radical concepts, I know, but they have a history of fighting onerous FDA regulations and winning. And they are the hosts of these committees that have drafted the regulations that have been adopted in 16 states. The other document to guide us is the American Herbal Pharmacopoeia of Cannabis Monograph. This is a regulatory document used to guide agricultural industry. These white papers are used by the USDA, the FDA, European Union to guide agricultural production. If you've never seen it before, the cover there, that's actually the farm at the University of Mississippi that's been growing cannabis for damn near 40 years. Interesting fact, for decades now, hundreds of cannabis cigarettes, thousands are leaving there every month, and there is no black market for their product. Interesting idea, but if you can see here, there's this fence in the background. It's a 15-foot high barbed wire fence with those little white dots are cameras and a guard tower. And so this sort of concentration camp is erected to keep any of the cannabis plants from escaping. And one of the things about this cover, what I like the cover, is this is a snapshot of where we are. But this is Mississippi. And if you don't know what this is clay. And the reason it's grown in clay is not because it's the best medium in the world, it's because it's Mississippi. And that's all they have there. So, but this sets standards for identity analysis and quality control. So how do you identify cannabis when it's ground up and processed using microscopes and other techniques? How do you determine the purity? What are the methods that are appropriate? How do you produce it as a botanical medicine? This is not a guide to grow the most potent cannabis that you've ever smoked. This is a guide to grow a standardized product that will meet the health and safety requirements for botanical medicines. So this is actually was cited in California laws and product safety standards. It's cited in Pennsylvania for the quality control standards. It's cited in New York as well. But this basically is a guidebook for purity and accuracy. There's a therapeutic compendium coming out in a couple months, which will include dosing and administration for different conditions. Our chapter on epilepsy is already available. So we take these guidelines from AHPA and AHP, and they're important because right now we have a system designed to fail. A lot of people talk about Mississippi cannabis. The reason that it's designed to fail is, one, is if you actually get permission to do a clinical trial, it's only approved for a month or so. Short-term clinical studies are only ever approved for the cannabis from Mississippi. Second, if by some chance in the narrow window of time you're allowed to conduct your study, you see a positive effect, such as Donald Abrams did when he had HIV/AIDS patients smoking 3 cannabis cigarettes a day for Mississippi, and they noted significant improvements in weight gain, you can't get the same product again. So it's an IND program where if the drug works, you can't get the same product again because this material is not standardized from there. And so by following these standards, we can create the true source of standardized products in this country, which will actually lead to long-term clinical studies. And this is what will build the practitioner confidence in these products. And by having standardized products, your cannabis no longer becomes a last resort. And so this is a seal that goes on companies such as a dispensary, a laboratory, a manufacturer, a cultivator. And what this seal means is that they have been assessed for their documentation and the facility has been inspected. Some people call them audits, some people call it assessments. But if you're compliant with state and regulatory guidelines, if you're compliant with our standards, it demonstrates your commitment to purity and identity of the product. And you'll get these seals on your product. And these are some of the standards we cover, including ancillary operations like transportation and other operations. I'm happy to talk to you guys about that more. But this, in a sense, sums it up. This is a nonprofit third-party certification program. We have a review board which reviews everything we do. Seed assumption, quality standards. We require staff training. We provide training, educational materials. And it hinges on facility audits, actual inspections. We do government relations. We offer a complaint hotline for any of our clients who join this program. We are also offering training. We have a training next month, and our flyer is available about it in Sacramento, 17/21st. It's a week-long training. Our program is the only certification program to get the first of its kind contract with the District of Columbia in Maryland to provide education and training to their Department of Health, to their regulators, to their industry. We also help create the educational modules used in New York State for physician education that they're required to take. That was done through the answer page at Harvard University with Dr. Stephen Korn. Moving on. So that was our program. The reason I mention it is because some of the farms that did this research are part of our clients, and some of our certified operators. But this is a picture of a lettuce and herb farm. So when this farm registered with the Department of Food and Agriculture, he or she was not required to declare the number of lettuce plants, number of calendulas that were planted. He simply was required to declare the square footage. How many beds, how wide? 4 foot by 10 foot, there's 3, 4 of them. Right? So, and that's something to think about. So, what we're going to think about throughout this presentation is how do we grow cannabis to be regulated in the same manner as other agricultural products, right? As a crop that's produced for human consumption. And while we're going through this, I want you guys to think, if you can name one plant, you'll win a fabulous prize. You can name one other agricultural product that's produced 100% indoors. So what are the cultivation techniques allowed by law? Well, typically the most common is indoors. Some areas allow greenhouses and row covers. Very few allow open air or field-grown cannabis. We see, greenhouses, light deprivation, and open air field-grown stuff, as you'll see, require way less resources to operate. So, often state medical cannabis programs and adult use programs require the cannabis to be grown indoors. This type of legislation is really an out-of-sight, out-of-mind approach to regulations. We can't see it, we don't know it's there, everyone's happy. The only reason this started was due to prohibition and hiding from law enforcement and trying to avoid felony penalties. That's the only reason that this model exists. Cannabis is currently the only crop produced for human consumption that is primarily produced with 100% artificial light. Notice this picture. This is under a plant number model. The plants are really, really, really big. But what's interesting is for every 2 plants, there's a light. And so this still has several weeks to go until it's ready for harvest. So what are the environmental consequences associated with cultivating cannabis using 100% artificial light? So in 2011, Dr. Evan Mills authored a carbon footprint report on indoor cannabis. What this report is, it's a bit dated. We have updated it in later slides, but it acknowledges the effects. So U.S. cannabis production and distribution energy costs, so people are paying their bills for growing cannabis, costs about $5 billion in this country. That equals about 17 million tonnage per year of greenhouse gas emissions, and that's roughly equivalent to the emission of 3 million cars on the road per year. So that's what's being regulated and made into law when we think about indoor cannabis production. So what does this mean in practical terms? Well, if you're consuming indoor cannabis, roughly 1 kilogram of cannabis, 454 grams, takes about 2.8 tons of CO2. So that's how much CO2 you're generating. It's equivalent to basically 5 cross-country trips in a hybrid vehicle. 1 cannabis cigarette from an indoor cultivation results in about 2 pounds of carbon dioxide being produced, equivalent of driving 15 miles in a 44 mile per hour car. It's equivalent to operating a 100-watt light bulb for 17 hours. That's just for 1 gram. So where is the energy being used? Well, about 30% of indoor energy is spent on lighting. Another 26% is spent on ventilation humidifiers. You have another 18% on air conditioning. 4% on heating, and so almost 80% of its electrical use is based on lighting, ventilation, heating, air conditioning. All things that are taken out of the equation when you move outdoors. So when we think about the potential impact, we have to think about where does our electricity come from in this country? Where does our power come from? Well, according to the U.S. Energy Information Administration, almost 40% of this resource comes from coal. 27% natural gas, about 20%, 90% nuclear energy, and then we have other renewables. And so what does indoor cultivation look like? Well, to me, indoor cultivation looks like this. This is the future of indoor cultivation.
That's what it looks like.
So by allowing or even encouraging the use of grow houses, such as greenhouses or with row covers, superstructures, we could eliminate 75% or more of light use of electricity use. Multiple harvests can happen per year in outdoor cultivation.